Welcome everyone and good afternoon. Welcome back to day 2 of the Lifespan Respite Grantee and Partner Learning Symposium. I hope you all had a wonderful evening. I'm Jill with the Arch National Respite Network and Resource Center, and I know we on this end are all still absorbing all the great information and resources we received yesterday from all of you, and we're really looking forward to today's presentations. In reviewing the chat last night, we were really happy to learn that so many of you are planning to harness that energy and the shared best practices for this event as you move forward with your Lifespan Respite Grant activities. And of course, that is our goal for these 2 days, to give you some really useful information and re-energize you in your work. I neglected terribly yesterday to thank our wonderful Arch staff and consultants, Cassandra for her skill at seamlessly getting your PowerPoints and documents up on the screen yesterday. I do want to let you know that she does have so many other creative talents, and I'm so grateful to have her on board, and I encourage you to reach out to her for assistance at any time. I also want to thank Susan for her help in monitoring the chat yesterday and helping us identify questions and important points for discussion. And of course, for ringing the bells. She may be ringing them a little bit louder today. Give us another sample, Susan, so people will know what to listen for if you go over your time.
Okay, I think yesterday I maybe was too gentle because I didn't want to offend anybody. Can you hear
Isn't
that?
Lovely?
That work?
Yes, those are lovely chimes.
Okay.
And as there was quite a bit of discussion yesterday too about surveying caregivers and data collection, and as all of you engage in collecting program data, I hope that you'll feel free to also send any questions today or reach out to Ray, who's our research and evaluation expert, as well as to Susan and Cassandra, because all 3 of them are evaluation experts as well as respite experts, and they are available to provide any technical assistance you need as well. I just wanted to show you the agenda again. You all should have received that by email, and it's also available at that link at the bottom of the screen. The agenda will pretty much follow the same structure as yesterday, with bring, brag, and borrow at the center of the day, and then a self-care break, followed by our question and answer and discussion section, and a wrap-up of lessons learned and ideas for future training or products. I put that link to the participant list and the agenda and the schedule of bring, brag, and borrow presentations for today. I'll put that in the chat box too, because once I leave the screen, you won't see that link again, but you'll find it in a few minutes in the chat box. To introduce yourselves again, we're going to do something similar that we did yesterday, to let us know that you're here. We'd appreciate it if you would take just a moment and respond to this question in the chat box as we proceed. We'd really love it if you would tell us something you learned yesterday that surprised or excited you, and why. I think that would just be very inspirational to hear your thoughts on that. And we can certainly promise you more excitement as the day proceeds today. So again, while we're all chatting now, just tell us about something you learned yesterday that surprised or excited you, and why. And if you just type in what state you're from as well, that would be really helpful. Yesterday, we also, what we asked at the beginning of the symposium was what it was you would like to get out of the 2-day event. And here are some of the highlights that we pulled from the chat. Great ideas on how to strengthen programs, energy for pushing forward, ideas, better outreach to caregivers in rural areas, outreach to the medical community, employer engagement, convincing caregivers to use respite, different ways to run voucher programs, using volunteers and working with different systems, keeping respite available to caregivers in times of crisis, how to support caregivers during the pandemic and going forward, ways to measure the impact of respite during the pandemic, and last but not least, share, connect, and support one another and renew ourselves. And that maybe perhaps is the most important of all of those. So thank you for sharing all of that. Let me go back to that slide for a minute, because I did want to recap a little bit that we did cover some of these topics yesterday. I am happy to say that we did address some of these, including how some states like Oklahoma, Tennessee, Virginia, and others have adapted respite to serve, especially during this time of the pandemic, to serve caregivers in rural areas. We heard lots of tremendous ideas about providing respite and respite alternatives during the pandemic. And we certainly learned about various ways that states are undertaking and implementing various approaches to voucher programs, and even how to measure the impact of COVID on a voucher program. And I'm delighted that today we're going to be hearing about engaging employers in supporting caregivers from Colorado and New York. We'll be hearing about educational resources for medical providers about respite from South Carolina, and about using volunteers in Rhode Island, and really so much more to look forward to today. So again, we're very excited about that. I wanted yesterday to provide a quick update of ARCH, especially for so many of you who are new to our network, to just give you a really quick overview of what resources we have, and what's coming up in the next couple of months that we hope to get to you very soon. We do hold regular webinars. These are the most recent webinars from the past year. One on charting the life course respite tools. And you heard a little bit about those life course respite tools yesterday. We developed them in conjunction with the University of Missouri. And they're wonderful tools that you can use with family caregivers, or work with family caregivers to complete them on their own, to plan their respite time, to identify respite resources in their communities. It's just a great tool to start engaging caregivers around respite and what it is and how to use it. We did a great session on state respite legislation with John Bartholomew from AARP and our own Kathy Mayfield Smith from South Carolina, talking about their state efforts. We had a great webinar on tools for employer engagement that we did in conjunction with the Extension Service at the University of Wisconsin. And I believe some states, New York and others, are even using that tool to begin to talk to employers about respite and caregiver supports. And then we heard specifics about veteran-directed care from people at ACL and from the VA who talked to us about how the program works and how respite can be provided through that program. So if you missed any of those webinars, or webinars from even earlier than the past year, you can find them all on the ARCH website. I especially want to mention that we have two ongoing learning collaboratives, one on voucher respite, and this is a very committed group who are really interested in talking about challenges and successes and implementing their voucher respite program. And we try to meet at least quarterly. There are several of you who are leaders of this collaborative, and we're grateful for your continued work to help move that learning experience forward, and that will be ongoing. The Sustainability Learning Collaborative, and that is now really developed into a small working group, that dedicated and passionate group of about 6 states that meet monthly to provide their updates on their sustainability planning processes, and to get input and guidance from their colleagues. And we welcome others to join that as well. And Susan Summers with ARCH helps facilitate that collaborative. So if you want to learn more about that, you can reach out to Susan. Some of the new written products that we've had this year, we did release a new fact sheet on respite as a support service for adoptive families, and then a wonderful update of a fact sheet on crisis nursery care that our own Cassandra Furman, who's an expert in this arena, did for us. And part of that fact sheet is also a national listing of all the crisis nurseries that we're aware of. So we're trying to keep that list current as well. We updated our Medicaid waivers for respite support, which I hope it's useful to you in the States. We get a tremendous number of requests for this information from some of our national partners, from policymakers around the Medicaid waivers that pay for respite, and all the changes that have been going on around changes in flexibility around COVID, and also as states move to managed care, how the waivers are changing. And this wonderful document was prepared for us, again, by Kathy Mayfield Smith, who is not only the founder of the South Carolina Respite Coalition, but she's an expert in this arena. So from within our own network, we have expertise in this area. So we're glad to share this document with you. You can look at the Medicaid waivers as a compendium, so you can search across states for types of respite that are provided, or populations or age groups that are served. You can also pull it up separately from a state map. If you want to look at just the Medicaid waivers for your state, you can click on the map and pull that up. And then finally this year, we released the state summaries of Lifespan Respite grant activities. Many of you may remember Susan and I asking you periodically to send us your federal reports, your semi-annual and your final reports and your applications, so that we could compile these wonderful state fact sheets of the summaries of your Lifespan Respite grant activities. And these also are available as a compendium, so you can search across states if you're looking for volunteer respite examples, or coalition examples, or anything that you're looking for. You can search for those words in the compendium. Or if you're just interested in seeing your state summaries, or summaries from a particular state, you can click on them from another US map. And then finally, exploring respite opportunities and options. We pulled this together right before the pandemic, but what it does is provide lots of ideas directed toward family caregivers about alternative ways that they might be able to get respite outside of the formal service system. It also talks about formal respite services as well, but it was really a little bit fortuitous that we pulled this together right before the pandemic, because it turned out to be a very useful document as people were really starting to rely more on informal ways of accessing respite, and we already had this little database put together. So these are all available on the ARCH website. If you have trouble finding them, I'm happy to help you navigate. But these are the links, and again, these slides are posted up on the ARCH website, so you can get to them all from that one link that I sent you earlier. The last couple of months, just like all of you, we've been really focused on providing ARCH COVID-19 respite resources. We've got one webpage that's dedicated to resources, government resources, resources from other national aging and disability organizations, information on self-direction during the pandemic. And then we also have a whole page of resources focused on parents and caregivers that would be particularly helpful to them. We continue to partner with the Break Exchange and the International Short Break Association, and with them, Susan especially helped analyze the findings from this global survey on respite best practices. And if you missed the webinar a week or two ago, it's now recorded, and you can archive the webinar and some of the preliminary results from that survey. I think there were responses received from 15 or 16 countries. So it's really a fascinating exploration of how community-based agencies are responding to providing respite during the pandemic. And of course, many of you have been participating in our Lifespan Respite Network COVID-19 and respite check-in calls. We hope to resume those in the next week or two if there's interest in doing so. I know it's been really important to all of you to be able to talk to each other as things are changing so rapidly. Arch also learned from our Colorado Respite Coalition partners about a COVID-19 Caregiver Ready certification. It's training that's offered online, and we purchased a number of seats that we're giving away to our network, and we've had quite a few people take us up on that, but we still have some seats left. So if you'd like to take that training, or you have some respite providers or family caregivers, it's also a very useful training, I think, for family caregivers who are at home providing hands-on care. Please let me know, and I can send out the unique links so they can participate in that training. And then finally, and probably of greatest importance, is that we have, and at your request, at all of you who requested that we do this, we formed a work group and have partnered with Kim Whitmore, who also heads up the Break Exchange, but she has a wonderful public health background and is a PhD nurse, to help us develop these national respite guidelines for reopening and running respite during the pandemic. And as we develop these guidelines, we really want to be able to feature case studies of programs that are successfully running during this time, or that are successfully reopening and are willing to share their procedures and protocols and trainings for doing that. I think that'll be part of our regular respite check-in calls. We'll be trying to feature case studies of programs that have been able to do this successfully. And because it's happening in real time right now with the pandemic, we really are rushing to get these guidelines out, hopefully by the end of June. And then finally, a couple of things that are in the works. I wanted to, some of you may have already gotten an email about this from the International Short Break Association, but we do now have dates for the next conference. We're going to hold it, hopefully, if all goes well, over the next year, June 22nd through the 25th at Monona Terrace in Madison, Wisconsin. And we have reserved that first day, June 22nd, for the Lifespan Respite Grantee and Partner Learning Symposium, or your Grantee meeting. So please get those dates on your calendar and don't book anything else yet. And if we have to, we'll hold at least the Grantee meeting again virtually. So save those dates. Sorry about that. From all of those wonderful state summaries of your Lifespan Respite grant activities and objectives that Susan pulled together, we're now looking at across states at all of those and have developed some inclusion criteria. And we're trying to pull out from those reports all of your best practices so we can highlight them in a more succinct and glitzy report that hopefully will really help us talk to the public, talk to policymakers. Maybe you can use it to talk to funders about what Lifespan Respite is and does. And we should have that finished in the next month or two as well. We are updating the volunteer respite manual. That's in layout right now. We've done a lot to update all of the links, new case studies. It's a rather thick manual, so we will be printing it and making some copies available. I know a lot of you have used that in your own volunteer trainings, because there's so much more to running a volunteer program than just training the volunteers. It's making sure the program surrounding the volunteers is supportive and able to recruit and train and supervise volunteers and run the business aspect of it as well. So we're really excited that that is going to be updated. Our federal guide to respite funding, which hasn't been updated in a few years, also is in final draft. Innovative and exemplary respite services. Some of you may remember that we did a national call for applications for innovative and exemplary respite services last year and recognized quite a few programs at the national conference in New York in 2019? And we opened up the application again, and we just finished the selection process for new innovative and exemplary respite services. Again, this is something Susan and Cassandra have been working diligently on And we hope to announce those that we will be recognizing as innovative or exemplary again in the next few weeks. So we have a lot happening at the end of our project year. And then finally, we want to keep talking to you about the life course respite tools. And we'll be talking to you, hopefully maybe showcasing as more of you start using the life course respite tools and are willing to share how you're using them. I'm also working on a webinar for July that will talk about using the life course respite tools in light of the pandemic, because our friends at the University of Missouri have been doing a lot around adapting those life course tools or showing us how to use those tools more effectively during the current situation. So we're very excited about that. And then finally, I wanted to talk a little bit about the work that we continue to do around respite research. Some of you, again, have been around long enough to know that it's more than several years ago now, probably 5 or 6 years ago, we convened an expert panel on respite research that was facilitated by Ray Kirk. We had some wonderful participants on the expert panel. They did a final report that included research recommendations for encouraging researchers and funders to move forward together to continue to build an evidence base for respite. And we didn't want those recommendations to sit on a shelf, so we we kept adding to our list of known researchers and funders who are interested in respite and caregiver support, and built a respite research consortium. And I think we have about 90 researchers and funders on that list right now who receive regular updates, quarterly updates from us on new respite research, on funding opportunities, on just new reports that have been released that relate to respite and caregiving research, so that we can keep them engaged in the work that we're doing and hopefully encourage some of them to continue conducting research. We did manage to, with Ray's expertise, developed a grant with the Health Foundation for Central and Western New York to fund a respite study. Several of other researchers engaged, got some of their own funding and engaging in research using the framework from the expert panel. And some of this research we had planned to highlight at the Respite Research Summit in Wisconsin this year, which again we had to postpone. But because we really want to move forward with this, we will be holding the Respite Research Summit virtually in September or October. We're trying to find a date that works for all our presenters, our researchers who had agreed to present in Wisconsin, to find a date that works for all of them so that we can do that virtually. And so again, if you're interested in listening in or participating in the discussions around that, we hope we'll be generating a whole new set of recommendations that build on our previous recommendations to move respite research forward. We'll also be continuing, hopefully, our partnership with the Break Exchange. And the Break Exchange, for those of you that don't know a lot about it, is BREAK stands for Building Respite Evidence and Knowledge. And it's an international group of researchers, respite providers, agencies, and individuals who are committed to building a culture of evidence-based respite care. We did hold that webinar jointly with them around the global survey recently, and we hope to continue to work with them, especially around helping to promote research for our innovative and exemplary respite services as models to be studied further. So we have some interesting plans, if we're funded again, to continue to partner with this wonderful exchange. And that is based at the University of Wisconsin School of Nursing, again headed by Kim Whitmore, who's become a really vital part of our ARCH collaboration here. And then we have our annotated bibliography. I hope you're all aware of that. We're continually updating it. We're doing another update right now. I try to pull information from that as I find it also, and prepare fact sheets that we use on our through the National Respite Coalition, our policy work. So if you're ever in need of any data about, especially around outcomes for respite for family caregivers and care recipients, let me know and we might be able to find some compelling data for you. So that's my quick update of everything we're doing, and we have a few minutes before our next guest. So does anyone have any questions? Let me unmute you all, or you can unmute yourselves if it gets too noisy, and asking a question or type one into the chat box. Or Susan, have you been monitoring the chat? Are there any? Not any real questions yet.
No real questions. Wonderful comments about yesterday's presentations.
Wonderful. I can't wait to read all of those.
So, Jill, I have a question.
Yeah.
I've noticed that a number of people have similar interests and have made similar comments about yesterday's presentations. And you grantees can contact one another about your interest after hearing presentations, but maybe we would like to convene just some hour and a half kind of roundtable discussions, kind of casual conversations about topics that a number of people are interested in. Could put that out to grantees and see if people had interest, so we could dive deeper into some of the topics that we've covered these 2 days. You know, not a long-term commitment like like the learning collaboratives, but just some, you know, facilitated conversations. So anyway, I'll put that out there and see if anybody bites on that one.
Thank you. Lisa Schneider also is reminding me to remind you that we'd love it if you can actually join the break exchange at that. Let me go back to that link. You can join the break exchange yourself to stay engaged with them, or you can also like the Facebook page where they post a lot of wonderful information about new programs or research that are happening internationally. And Lisa's put that link in the chat box.
This is Cassandra. I want to second what Susan and Lisa a few minutes ago and Jill said. Both of those comments, Susan, I would love to see some roundtable discussions about some of the things that came up yesterday. I'm especially interested in the mini grants that were discussed to help caregivers during respite. And the break exchange has been fascinating. That last webinar talking about the research that was done internationally that Susan and Kim participated in. I just strongly recommend, if you haven't visited the break exchange, please go there and participate any way you can. So that's all I have to say. Thanks.
Got several thumbs up on the roundtable discussion, Susan, so great idea. Any other questions about new products coming out, or maybe ideas about other training and technical assistance needs that you have? No? Well, I'm not sure if Administrator Robertson has joined us yet. I don't see him on the participant list. Lori, do you happen to know if he's joining us soon?
I actually saw his name on the screen.
Oh, I'm sorry.
Hey, can you hear me? I'm on.
Wonderful.
There he is.
Thank you. We're so glad to have you with us today.
Thanks, Jill. Good to be with you.
I am really honored to introduce our guest today, and I just am thrilled that he took the time from his really busy schedule to be with us. So I'd like to welcome Administrator and Assistant Secretary for Aging, Lance Robertson. As many of you already know, supporting families and caregivers is one of the 5 pillars of his vision at ACL. So again, we're really honored to have you here with us, and please go ahead and take all of the time that you need to talk to us. We're so excited to have you here.
Oh, that's very gracious, Jill. I'm glad to be with all of you. And I have a few prepared remarks, but then happy to answer any questions if you have a few at the end, and then we'll turn it back over to your symposium. I hope it's going well. And again, always appreciate an opportunity to pop on and say hello and to say thank you. I know that during this time, really for all of you, this is unmeasured in terms of, the challenges that you're confronting each and every day. Of course, it's a reinforcement of all of our mission, certainly to do all that we can for family caregivers, and the great work that you guys do in supporting respite programs, I think, has never been more important. So thank you. And I know Jill knows me. I don't know how many others paying attention or are participating know much about me. So I'll just quickly say that I'm an Oklahoman, born and raised by my grandparents, and a veteran, a guy that worked in higher ed for about a dozen years and then was a state administrator in Oklahoma, which is actually the timeline within my chronology I thought I might point out, because I had direct experience, of course, in working with respite programs. I was Oklahoma's Director of Aging Services for a year. And actually Oklahoma, in case people aren't aware, Oklahoma actually developed the first Lifespan Respite program. That was back in 2000. And that was actually, I guess, 6 years before the creation of the federal program that we now administer here at ACL. And we were also the first state to pass the CARE Act. So I'm really proud of my home state to, I think, be a pioneer in some respects around this critical conversation. And, really for us, supporting family caregivers, as you pointed out, Jill, it's one of our 5 pillars here at ACL. Obviously, it's the bedrock upon which I think we have built everything we are committed to doing, and that is, how do we make sure that these family caregivers are supported in a way that is meaningful, and it's certainly at the core of our business. So it's no surprise, of course, that during this extraordinary time, as I said, that the pandemic really has been all-consuming, but has really, I think, afforded us a chance to demonstrate flexibility and creativity, resiliency. All of those things are paramount in the work that we do. And of course, one example of that is you guys meeting by Zoom. Who would have thought that fast forward to June of 2020, you would all be meeting virtually? And I think, like you, Jill, so many of us are tired of the virtual stuff. It works well, but I can't count how many virtual meetings I've been a part of, and now I'm ready to actually see some folks and say hello when the time is right and we can do that safely. But again, thanks to your resourcefulness, Jill, and your continued leadership. And then also, I know you have to love working with Lori. She is just a bundle of energy, and we're glad that she's on our team, and she now handles, as you know, the Lifespan Respite program, and she's our new program officer at ACL over that area. So since the beginning of the pandemic, like I said, I've consistently been amazed at the creativity and flexibility of all of ACL's grantees. We're talking about 36 different lines of business programs, if you will. And it's just been so heartwarming to see the commitment. And really, I think it's best exemplified in how we have continued across almost all of those programs to continue delivering services. And, think about meals and so many other things that we do as a common course of action, and how those services continue, but now they're arranged differently. They're arranged safely, but still as effectively as they ought to be. And again, I think that it's a real tribute to the network and our ability to step up. And really, I think for those of us that have been in the network for a long time, myself, nearly 30 years, this is normal for us. Now, the pandemic's not, but dealing with difficulties has always been sort of a mainstay in how we operate. So again, I think it's just, fabulous that all the different program examples that have been shared with me specific to meaningful respite options, again, just really resonates that commitment. I know I'm looking at examples from Alabama and Colorado where they joined forces to hold a live Facebook event to answer questions for caregivers about respite during the pandemic. And then in Wisconsin, where they developed an online training called Finding Your New Normal during COVID-19. And again, that's available to, anytime for caregivers at no charge. So Jill, I also hear you have recently convened a work group to develop voluntary national respite guidelines to help in-home and out-of-home respite providers reopen safely. And of course, that's a real critical part of the conversation happening right now in DC is around reopening. So we know that family caregivers are, of course, the foundation of long-term care everywhere, and that without them, the long-term support system that we've grown to rely on just would not be there. And we must do all that we can to really make sure that these family caregivers have the services and support that they need to continue the critical work that they do. And as I'm sure that you've all seen, and I know I've certainly heard, supporting family caregivers is absolutely essential during this time, particularly when their scope of service, their duties, what their normal day looks like has in many ways also changed quite dramatically. I think about, those sandwich generation caregivers who now have kids at home that they're having to homeschool, and then many of them are teleworking themselves, and now they're still caregivers. So all of that really creates a unique formula, and I know it's testing them, it's testing us. And we know that, research tells us that our programs are certainly critical, and that respite among them really is one of the key components to making sure that that caregiver support is where it needs to be. Because without that necessary break from caregiving duties, we know that the physical and emotional stress of those caregivers certainly continues to just climb. Caregivers have been able to, of course, access and use effectively some of that high quality respite service that we offer. Sometimes, however, finding those services isn't always easy. Sometimes there aren't enough qualified providers, or there might not be a program or funding source that can meet the particular needs of a family who needs that respite. So the Lifespan Respite program works to expand and enhance respite availability, improve coordination, and fill those gaps in respite services for family caregivers. So since 2009, ACL has funded 37 states and the District of Columbia to build or improve upon their capacities to provide respite to family caregivers from across the aging and disability spectrums. The Lifespan Respite Care Program partners with, as all of you know, the Aging and Disability Resource Centers and statewide respite coalitions to help states develop lifespan respite care systems. And over time, respite care systems and services and programs, of course, continue to evolve in various states. So by working as a coordinated lifespan respite care systems, we can learn more about the demand for respite care, the availability of respite care, innovative strategies to provide respite care, and then of course, which is always so critical now in conversations, how do we calculate the value and the return on investment by offering respite care? And again, we know that those families absolutely rely on that. So I'm grateful for all the work that all of you put in each and every day. And it's really hard to believe that this program now has been running for 11 years. And this year, of course, marks what I think is a new chapter in the Lifespan Respite program. We had 3 funding announcements out earlier this year. One was to fund the next steps in our technical assistance efforts to support program development. Another funding opportunity was available to new states, to bring new states on board to work in this area. And then finally, a third opportunity was available to the existing 37 states in DC that I referenced, who've previously done work in this area, but to help fund blazing new trails and doing new things, developing newer, more creative ways of providing respite to families across the aging and disability spectrum. So I'm really excited about the future of this program and each of the states that are working to develop and improve their respite systems. And I'm also looking forward to the new advancements that we can make in supporting the field through what I know will be even more targeted approaches to technical assistance. So just know that as you work to further develop the Lifespan Respite program, you're working in an area that is garnering a great deal of attention. For instance, I know that all of you have probably heard of the activities involving the RAISE Family Caregiver Council, which we are responsible for here at ACL. My team, including Lori Stahlbaum, are working hard with members of the Family Caregiving Advisory Council to publish the report and develop a national caregiving strategy. And I can tell you that respite will be a prominent component of that national strategy. The work that all of you are doing will be key to ensuring the goals and objectives that are laid out in the strategy are inclusive of the most up-to-the-minute ways to deliver effective and high-quality respite care. So again, let me wrap up by saying thank you for all that you do and continue to do for families and caregivers in the months and years to come. Each of you are true heroes in my book, and I applaud the hard work and tireless dedication each of you brings to your work. So please enjoy the rest of your time together and this Learning Symposium, and thank you, Lori, for her leadership and helping pull this together on ACL's end, and Jill for your outstanding and long-tenured leadership in this important space. So again, thanks for an opportunity to say hello and to encourage all of you, and I'm so grateful for the work that you do each and every day.
Thank you so much, Administrator Robertson. I can't tell you how fortunate we are to have such an amazing champion for caregiving in the Administration for Community Living, and we're very, very grateful for that. And we're especially eager to see what comes out of the RAISE Family Caregiver Advisory Council, because I think that will set the direction that we're all hoping to go in over the next decade or two. You said you might be available for another couple of minutes to take any questions. So
Happy to do it.
does anyone have a question? Just feel free to unmute yourself and ask a question or type one in. No questions?
That's okay.
I'm shocked.
Hey, that's all right.
You have this wonderful opportunity to have you with us. Maybe you could, I don't mean to put you on the spot with this, but do you have a sense of the timing of the release of the RAISE Advisory Council report at this point, or is it just too early? And I'm sure Lori can keep us informed about that as well.
Well, as you can imagine, Jill, we're very cautious about putting any timelines out there.
Yeah.
Just for the sake of not wanting to overpromise and underdeliver, although I don't anticipate that's going to be the case. Of course, Congress regularly pings us to find out what the latest is and how we're coming along. So the commitment level has never been higher. Matter of fact, during COVID, we've continued to meet. Obviously, we're doing that virtually, continuing to make, I think, great advances towards the development of the national plan. We have just a phenomenal group of people that are helping us formally. And then, of course, as you know, we're always soliciting input. As a matter of fact, we had a request for information, and that RFI, I think, yielded somewhere around 600 different independent responses to, again, just general thoughts around how we can better support family caregivers in our country. So I'm really excited about the momentum that's being created. And not only with that committee, but also grandparents raising grandchildren, both equally important conversations in their own respect. And I think that it's ACL's opportunity to continue to lead out and to really support the great work that all of you do. That's where the magic happens. We just get to be your federal partner and are honored to do so and representing your needs and your interests. And again, like all of us, though, I hope that the development of the national plan will drive a higher level of commitment out of Congress and out of the administration for really doing some things that we all hope can be highly meaningful. It's not going to help if it's just another report that looks good and sits on a shelf. I mean, we really, of course, are moving boldly to make sure that it is chock full of just really, I think, some great ideas that people can get behind and support and hopefully create, a coming decade of really just unprecedented support for family caregivers.
We did have one question that follows up on that, if you don't mind. Alicia from North Carolina would like to know, how will the national plan be incorporated with other federal initiatives, such as the Family Caregiver Support Program, Lifespan Respite, the BOLD Act within CDC, et cetera? That's a very good question, because I think that's the goal.
Right. Yeah, absolutely. And, to that point, as we all know, and one of the first activities of the council was to actually, of course, do a landscape analysis of, what programs are out there, what initiatives have previously been launched, what worked, what hasn't. So again, we're certainly familiar with all of those different, both previous and standing commitments on behalf of the government and its support of family caregivers. Really what we hope the Act can do and what our activities will do through the course of the plan is kind of pull all that together, synthesize it in a way that says, okay, we really appreciate all former activity and even some of the things going on now, but for us to be the most effective as a plan, this is what we would propose. And the great thing is it really, I think, is a plan that crosses a number of federal agencies that are operating in this space. The first that comes to mind is the VA. As we know, the Veterans Administration has invested a lot of money into supporting veteran caregivers, which again, while a unique population, isn't different in any way than what we all support and champion. So the question then for the council has been, how do we pull all that together and create, again, stronger synergy? How do we prevent a lot of duplication? How do we make sure that we're targeted in what we want to propose? So again, some of that is yet to be seen. Some of that's, again, being currently worked on by the council, but the research effort that was initially bitten off has really already started to pay fruit in that regard.
Yes, thank you so much. You're more than welcome to stay and listen to reports from the states. I know you have many other commitments today, but you are welcome to stay. And thank you so much for those very inspirational and energizing remarks. That's what we're all about at this meeting. So thank you again.
Thank you, Jill. It's my pleasure. Enjoy the rest of your time together. Thanks, everybody.
Thank you. Take care. As always, he's very inspirational and really committed to these issues, and we're glad he's at the helm. of moving that RAISE Advisory Council work forward, as well as Greg and Lori. Oh, thank goodness that they're the staff on that as well. So thanks to you as well. Now I think we're ready to move into our long-awaited Bring, Brag, and Borrow session that will be followed by our self-care break. The first topic, area of topic, is public awareness and outreach to caregivers and stakeholders. And again, if you want to, I did have a schedule up there, but if you want to pull up the schedule from that earlier link, please feel free to do that. I'll post that in a minute. And we have Brittany Huey from Alabama.
Hey guys, can you hear me?
Yes.
Okay, so today I am going to brag a little bit on our newest empathy training. As most of you guys know, and most of you guys got to experience in New York with Doris, we had the caregiver simulation that we were doing to kind of create empathy towards caregivers. So we wanted really to focus on the helping profession, student social workers, nurses, to kind of walk a day in the shoes of a caregiver, go through the social services centers, all of those things, along with most of them having some kind of a disability as well. So to kind of step that up or to expand on that, and if Jill, you want to go to that next slide. We began offering a virtual reality training for our caregivers to kind of create an empathetic response for the care recipient. So those who have the diagnoses of Alzheimer's, Parkinson's, dementia, whatever it is, it's important for us to share with our caregivers what they might be going through. It's very frustrating for our caregivers. It's very hard, but on the other end of it, our care recipients are frustrated too. Independence is kind of taken away sometimes. They don't get to do the things that they used to do. They think they're communicating one thing and it sounds completely different on the other end. So the way we did that is through embodied labs, and you guys will have like a link to that on my very last slide. But right now, so we have access to their library. Their library has a simulation, if you will, for hearing and vision loss, Alzheimer's, Parkinson's, and end of life care. So of course we deal a lot with that, as is, I'm sure, as everybody else does too. But as they add to our library, so they've kind of talked about adding autism, Down syndrome, things like that to that library. We'll have access to those simulations as well. So we offer these virtual reality experiences individually or in group settings. We kind of started off with open labs, if you will. So we would advertise which lab we were going to do, which diagnosis. We'd have people RSVP or schedule for a time slot to come in to our office and kind of go through the experience here. We did not have the opportunity to take it on the road yet, but it will be taken on the road. COVID kind of messed that up for us. But plans are underway right now to expand this training opportunity. So in the newest proposal, we are wanting to take this out to first responders, law enforcement, and then of course partnering still with our state and local agencies, because we think it's very important for those folks who are going to be in contact with caregivers and care recipients to know what's going on, and hopefully recognize some of those things. Jill, if you want to go to the last slide for me. So if you guys want more information, of course, you can contact Tracy. You can email me. The website for Embodied Labs, which is who we purchased this VR equipment and the subscription to the library through, their website is up there. It's just embodiedlabs.com. You can watch a video on that website as well. And it was also, which I thought was pretty cool, featured on the show The Doctor. I don't know if anybody else is familiar with that, but so we thought that it kind of put some validity behind it. And like I said, there's 4 different ones right now when you get on the website, and then also on our full presentation, which I believe Jill has posted, you'll see the different care recipients who we have. So we've got Dima, Alfred, there are 2 others, what their backstory is, and what the simulation is going to kind of look like. That's all I got though. So if you guys have any questions, again, shoot me an email, give me a call. I'm here back in the office, and I'll be happy to help in any way that I can.
Thank you, Brittany. That was really wonderful. And as always, you're at the forefront of the technology and empathy field. We'll now hear from Sarah Schmidt in Arkansas, and she doesn't have anything to share at this time on the screen. She has lots to share, but not on the screen. Sarah, are you with us? Don't forget to unmute yourself. We can't hear you if you're here. Let me see if she's signed in here. I don't see her on our participant list, so let's go to the next state. Megan Kluth from Colorado.
I am here. I'm ready.
Welcome, Megan.
Thank you. So I don't have a PowerPoint either, but yeah, perfect. So there's a link to what I'm going to talk about. So hi from Colorado. We are sharing the Caregiving Friendly Workplace Toolkit, which we released late summer, early fall of 2019. And so I think like a lot of other states, we've been talking for several years about how to engage with employers and really kind of present some information and resources to them in like as much of a collaborative way as possible. And so I came across through working with one of our local public health departments, they had put together a family-friendly workplace toolkit, and we thought it was a really useful document that's been used pretty broadly across the state. And so we approached them and some of the groups that worked on that and said, how would you feel about us creating sort of like a secondary piece to that that's more specific to caregiving? And they were receptive, which was great. And so this isn't exactly like that, but follows pretty similarly, and they were able to review it, which is really nice to have you know, somebody who doesn't have the caregiving lens every day have their perspective. And so basically the idea of this toolkit is that there's really no one-size-fits-all approach for employers. And I think we were seeing there have been so many great national tools that have come out around this issue, and we really were able to mention those and utilize what we learned from those to kind of say there's so many different ways that employers can go about supporting caregivers in their workforce, and that you know, it doesn't just need to be doing lunch and learns, but that can be a great starting point. And so the hope of this is that it kind of helps us, or really whoever's leading the charge with employers, to kind of create more sustainable efforts that really fit within their culture, and not say this is, you know, you need to do X, Y, and Z, because that may or may not work. And so I think it's helpful for us to kind of keep it under the umbrella of family friendly. There's been quite a bit of work and conversation around creating more family friendly work cultures in Colorado. And so I think it just fits very nicely under that umbrella. So kind of what we've done with this since we released it is I've sat on a group with that health department. They lead several initiatives around local employers focusing on kind of the health and safety in their workforce. And so we've been able to share a little bit with those groups. And then also I did a presentation for a large HR group that has several Denver-based companies that are clients that they do a lot of kind of HR advising with. And so we shared a little bit with them and have been kind of trying to figure out who can we sort of get our most bang for our presentation time, I guess, in terms of who works with broad varieties of employers, and how can we sort of test this across different industries, knowing that what works for you know, people that do more shift work may be different than more traditional office models. And so unfortunately, we kind of haven't done as much with it this year as we thought, given the pandemic. Our hope was to really get a lot more involved with this in early 2020, and that, you know, is a bit more challenging right now. So we kind of left it with having the toolkit and promoting it, and we have hard copies as well as digital versions, but please feel free to review it and share it, and if there's anything we can do to help other people's efforts with employers. I think it's absolutely a collaborative approach, and if anybody has feedback, that's also very helpful. That's all I have.
Thank you so much for sharing that, Megan. Appreciate that.
Thank you.
Next, we have Dina Press from New York. Dina, if you're with us, you may want to unmute yourself.
Can you hear me now?
Yes.
Oh, wonderful. Okay. I was talking and nobody could hear me. Just wanted to say thank you. I'm so appreciative of the fact that we're still able to gather, even though it's virtually, because I know for myself, I've been in the position now 3 years, and just each year have learned so much, you know, with this symposium. So thank you, both Arch and ACL, for that. And before I share, we have 2 things from New York that I want to kind of brag about, but just wanted to mention that it really is, you know, a team effort. So I'm representing New York, but, you know, Jen Rosenbaum, Abby Lavazzo from the State Office for Aging, and then Doris Green and Sharon Cackett from our coalition. You know, this work couldn't be possible without them. So just wanted to thank them. So our first thing that we wanted to brag about, similar to Colorado, you know, under our Governor Cuomo's leadership, we've been leading efforts to incorporate healthy aging into all aspects of government work. And investments have been made in caregiving services. You know, they've been extraordinary. The work that's been being advanced by the governor is especially important due to the growing number of workers that we have who are relied on by a loved one that is in need of direct care or support, you know, due to chronic health or disability issues. So this new guide that we've been working on, it was modeled after Minnesota's guide with their permission, and it's part of New York's statewide action plan for Lifespan Respite care sustainability. And it's designed to support New York's business community by providing them relevant information about caregivers in the workplace. It includes links to supportive services, programs, and helpful workplace data. It also includes information about the New York State paid family leave and employee-funded insurance benefit that provides workers with job-protected paid time off to care for family in time of need. Also within the guide, businesses will be directed to contact the New York State Caregiving and Respite Coalition, also known as NYSERC, to request assistance in conducting an employee wellness survey. NYSERC's been partnering with the University of Wisconsin to collect aggregated data statewide from all the surveys they've done. Additionally, NYSERC plans to provide training to these businesses in follow-up to the survey, such as the caregiver simulation that many of you likely remember from the 2019 National Lifespan Respite Conference. The guide is currently under review for approval, so unfortunately that was delayed due to COVID. So once it is finalized, we will be sure to share this new resource with Arch and make it available to everyone. The next brag is not something I guess you would think of as respite care, but it's really taken off here in New York due to the current public health emergency. And I did hear a few people make mention of it yesterday. But we've been hearing from providers that there's many benefits to this service in offering, you know, caregivers respite and giving their loved one a nice companion. So, you know, the care receivers, they're engaged and occupied with this robotic pet that's really allowed the caregivers some time to focus on other things, especially when, you know, many of them are being stuck home together right now. So I will share that this service model, it did start well before the pandemic hit. It was for socially isolated seniors. That was a pilot program that we did here in New York. And since then, it's really exploded over the last few months due to the stay-at-home directive. So for the pilot, I did want to share, because when I made mention of these pets on one of the ARCH calls, I did not have, some of the data from the pilot. We had 60 pets that were made available for adoption. So prior to the adoption, a case manager would conduct a screening using the Hajan-Jaravel Loneliness Scale screening tool, which I think, Jill, I had shared that with you in case anyone was interested in seeing the tool. And the screening was completed multiple times over a 1-year period. So at the pre-adoption and then at the 3-month, 6-month, and 12-month marks. After 12 months, we found that 70% of individuals who adopted a pet had a significant reduction in isolation. And one county actually also implemented a pain scale. And out of 4 clients, 3 of them went from a 9 out of 10 on the pain scale to only a 4.5 out of 10 in that 1-year period. So anecdotally, caregivers and children have seen a significant change in their loved one where they're more alert, they're picking up old things that they like to do, they're not sitting in front of the TV as much. So I think you can see how this model can easily provide a viable option for respite care. So in closing, I'd like to just share a quick 2-minute video that explains the robotic pets a little more.
Hi, I'm Brad Nelson. Here at Brown Furniture, we want to help you make your home your perfect place.
The houses nestled along North Country back roads might not be the New York most people know. But for Sharon Dion, this is where she feels most at home.
This is my husband, was my husband. This is Neil, and many years ago.
At 74, the retired nurse's aide lives alone. And like many with decades behind them, she knows what loneliness feels like.
They need something besides looking at the walls, sitting here, or knitting, and crocheting. They need something to do.
Staff from the Franklin County Office for the Aging stop by from time to time to make sure she's doing all right.
So you've enjoyed him since you got him?
This visit, they're checking on Sharon and Benji.
I don't care if I have to pay $1 million, I will not give that cat up.
These are called animatronic pets. We have dogs and cats that come in a variety of different colors and shapes. We've put about 60 of these pets out into the communities to test them and their impact on social isolation and depression among older adults.
Greg Olson is the director of the New York State Office for the Aging.
Social isolation is a huge public health problem, and I don't think that we've quite wrapped our mind around it, but it's at the level of osteoporosis, diabetes, obesity, hypertension.
Olson began working with aging communities about 25 years ago, and he believes these could be the solution to senior social isolation.
We've heard about the impact of music, live pets, in residential facilities with people with dementia and Alzheimer's disease, because you can see an immediate change in their affect. But I don't think anybody's ever piloted these in people's homes.
No, that's outdoors. You can't go outdoors.
Now there are dozens of homes all around the state that have an animatronic family member.
The day I got it, I cried.
Yeah.
I was crying so hard it was unreal. Because it's something to come home to. Without watching that television. It's something that you got here, and it's something to come back home to.
The Pet Project is one of many of the things that we do locally to really combat social isolation, whether it be pairing someone with an actual volunteer, providing a home-delivered meal with a volunteer that sees an individual daily.
It was a member of previous team who suggested Benji could be good for Sharon.
You know, seeing the impact of what a small pilot project could do really for the individuals in our community was not only heartwarming, but it's the right thing to do.
Now I've got something here that I can sit, enjoy, and watch and play. And that's what I do.
In her home, where Benji can be close by. In Franklin County, Leon Denyer, NBC5 News.
No, this came from Durham.
Thank you very much, Dina. I want to remind all of you to, as we're progressing through the Bring, Brag, and Borrow, hold your questions, write them down, jot them down. If you have questions, comments, type them right into the chat box or save them for our Ask the Expert so you can talk directly with our presenters. And our next presenter is Mary Welts from North Dakota.
Good afternoon, everybody, and greetings from North Dakota. I am going to set my timer because I would like to, before we get into the video, to talk a little bit about regional caregiver forums, caregiving for all ages, that were held across North Dakota. We, after Jill was in North Dakota and did the statewide caregiving forum, one of the comments was, this was really, really good. I think you should take the show on the road. So in North Dakota, we actually did that. We went around the state. We went to 8 different communities. We chose smaller communities, and we were at 8 different geographic locations in our state. The thing that was kind of exciting about it is it wasn't just our coalition that did the caregiver forums, but we partnered with the Workforce Development Task Force in North Dakota. So the schedule was for 3 hours. 2 hours was talking on caregiving, and 1 hour was talking about workforce issues in their areas. We were really encouraged, you guys. I mean, I'm not going to diss North Dakota. I love North Dakota. It's a beautiful state. But January and February in North Dakota can be a little bit challenging. But we were so fortunate that we had over 150 people who took the time out of their day to travel frequently in some stormy weather to come to North Dakota and participate in these. We had some pointed questions that we wanted to cover, and we wanted to make it a real regional focus. So through the course of the day, new partnerships were made. We were able to talk about not only the caregiving issues, but what were the opportunities for increasing the number of in-home care providers in their areas. So it was really, it was just really good times. And because of those, we have been invited to other communities to come and do it in their communities as well. But obviously COVID-19 hit, so we haven't been doing that. We're working on some options for virtual. The thing that also was kind of exciting is because we selected smaller communities, we got really, really good coverage, not only in their local newspapers, but also video coverage. The TV stations were there and TVs, so we got some coverage in that way as well. So very much worth the time that we put into that. And it was really just a lot of fun. So with that, let's talk about our video. What we wanted to do in North Dakota was just talk about a video, or develop a video that just talked about respite in North Dakota, how to access respite, what respite is. So right now, it's going to be the world debut today of this video. We're working on a formal communication plan to distribute this. We also are soon going to have a 30-second PSA for radio, and then also for television that will be available. And once COVID is over, we intend to modify the video to add personal stories. So we're looking forward to that. And we see this video being used not only in the media, but by professionals to just introduce caregivers to respite and to the importance of taking care of themselves. So with that, would we want to do the video?
Even the most dedicated and loving caregivers occasionally feel overwhelmed or exhausted. Caring for friends or family members who are ill or fragile can be exhausting physically, emotionally, and spiritually. That's why it's important to care for yourself first, so you're able to best care for others. And it can be difficult, especially when caring for someone you love, to know how or when to start with you. The most important thing to know is that you are not alone. Respite services throughout North Dakota are designed and dedicated for individuals just like you, people shouldering the unique challenges that exist on the caregiving journey. These services and programs are designed to help provide that brief, beneficial break from caregiving to help you avoid exhaustion, isolation, and the feeling of being overwhelmed. This assistance is available to all families and caregivers, providing ongoing care to individuals of any age, with any physical or intellectual disability, chronic or terminal illness, and regardless of family income, race, gender, or situation. Everyone's situation is different, and there's no one-size-fits-all solution. But as you consider taking care of yourself, remember, you deserve a break. Taking a moment to yourself to run errands, go to personal appointments, or simply to enjoy a little downtime is not a sign of weakness or failure. In fact, it's just the opposite. And the most important thing you can do for yourself is to ask for help. No one has all of the answers, and no one can do everything all of the time. Take care of yourself because you are worth it. To learn more about the resources available to assist you on your caregiving journey, including options to pay for these services, visit carechoice.nd.assistguide.net. We are here for you, so you can be there for them.
Thank you.
Amazing video, Mary. All of the states that have worked on messaging have done such a tremendous job capturing this information, but I think that's one of the best ones I've seen so succinctly. In under 3 minutes, I believe, really capture the essence of respite and how to get it. So kudos to you all there. Next we have Rachel Hatton from South Carolina Respite Coalition.
Hello, can everybody see me?
Yes, I hear you.
Great, great. Mary, that video was wonderful. We are also working on one in South Carolina, but you know, we have a model now that we want to reach, right? So that's great. I wanted to talk to you all briefly today about one of the things that we're working on is respite education for medical providers, and a video would also be part of that communications package that we're developing. But we've worked with our local university on a create-a-thon where they produce materials for us, and one of those was info cards and posters for medical offices to educate family caregivers while they're at the medical office about what respite is, how to access it, and have them begin thinking about what their needs are in that way. And then the secondary goal is to also educate medical providers on how to have those conversations with family caregivers while they're in the office to help them assess for respite needs and direct them to resources. And so we're further developing those materials that were produced, and so that we can have them part of an integrated info package that we send out to medical providers. As far as dissemination of that, we're working with First Choice, which is South Carolina's largest Medicaid managed care, and we will have that package available electronically and to mail out to medical providers later this summer. We are also working with ADT for their residential and medical services to help be in communication with providers and consumers. And then lastly, we're working really closely with the Faith-Based Community Nurses Association, and they've also offered to assist with dissemination to medical communities that they work with, because they so holistically work with their clients so that information can be available to the resources that they work with. So those are some of the things that we're doing. We have those representatives from those 3 agencies on our regional councils that further align the work of our agency with the work of medical providers, and then as well as lawyers, and have them sort of work in concert together for dissemination and education. So that's really all I wanted to speak with you about today, and I would love to talk with Mary more about her video and her communication strategy. So thank you all for your time, and this has been wonderful, and I look I look forward to working with y'all and hopefully seeing you all in person next year. Thank you.
Thank you so much, Rachel. I know that so many of us are going to be so eager to see your finalized materials, because outreach to the medical community, I think, is one of the most important areas that we've all been trying to figure out how to access. So we really look forward to seeing those final materials. So thank you for being at the forefront of that. Next, we have Tracy Lunsman from South Dakota.
Hello, good afternoon. Can you guys hear me?
Yes, welcome to the network.
Thank you. Yes, it's a pleasure to be here as a part of this group. As Jill said, my name is Tracy Lunsman, and I will be presenting sharing with you guys the South Dakota Lifespan Respite brochure. So the South Dakota Lifespan Respite brochure is a product of the South Dakota Respite Coalition in partnership with the South Dakota Department of Human Services. Back in February 2018, members of the South Dakota Respite Coalition's public awareness subgroup began to work on drafting the South Dakota Lifespan Respite brochure. Considerations that they had in proceeding on the venture were to review other states' websites and brochures, as well as our coalition partner organizations' websites and brochures for design concepts and topics. A lot of work went into the definition of respite, as well as a lot of thought and consideration was put into the graphics to provide visual aid and engagement. Our brochure is a classic trifold design. The coalition aimed to keep the brochure simple, clean, and easy to read. The colors chosen are consistent with the South Dakota Respite Coalition logo and complementary of the South Dakota Department of Human Services logo colors. The front cover depicts the South Dakota Lifespan Respite Coalition logo and provides a single clear message to grab the reader's attention with the goal of the South Dakota Lifespan Respite Coalition, which is to improve overall access to respite for families and other caregivers across the lifespan. Again, just a simple, clear message of what we're all about. The picture chosen for the front cover features a child and an adult. Our coalition chose this image as they felt it was depictive of the lifespan, as often respite is most associated with aging populations. So the aim of the image is to create focus on one of the key words of our program, lifespan. Upon opening the brochure is the who is eligible and the Dakota at Home resource directory sections. Dakota at Home is South Dakota's Aging and Disability Resource Center. It's our no wrong door system for information referral in South Dakota. So we aim to give the reader just enough information to get them interested and to use the brochure really as just a jumping off point to get to our online resources. You'll see there on the left the South Dakota AssistGuide.net link to Dakota at Home's online resource directory, which is searchable by keywords or areas serviced. It also provides an alphabetical list of agencies, organizations, and providers, as well as a learning library of national and state information and resources. As is standard practice, the back portion provides contact information, our phone number, and our website for Dakota at Home, as well as the South Dakota Department of Human Services logo as it's South Dakota's Lifespan Respite Program's lead agency. Should a consumer never get to the point of opening their brochure and browsing it in entirety, which we hope wouldn't happen, but the reality is that oftentimes it's common to pick up a brochure, read the front, maybe open it halfway and browse and flip it over. So at this point, consumers have likely made their decision whether to open it and read it in entirety or set it back down and move on. So at this point, they have enough information to make their next move. And then on to the next slide, or the next back portion of it. The inside heart of the brochure contains the what is respite section with the definition that our coalition chose for respite. Also, there is a respite wordle, just a nice colorful graphic to catch and engage the eye of the reader. The middle section contains the benefits of respite section, which the coalition felt was essential to list the benefits of all those involved in caregiving. Leading off with the most obvious, the caregiver. time to do something for yourself, visit friends, read a book, take a nap, go shopping, or go fishing. No activity is too small or insignificant to request respite for. The care recipient, an opportunity to socialize with someone other than the caregiver, which I think is often, forgot about. And finally, for the family of the caregiver, care recipient, which is oftentimes both, just reduce stress for everyone. The final section is the asking for help section, which is really just aimed to validate concerns often expressed by caregivers and justify that what a caregiver may be feeling at this point is normal and that it's okay. 5,000 copies of the South Dakota Lifespan Respite brochure were printed and distributed across the state to 24 Division of Long-Term Services and Support state offices, distributed to coalition members representing various state and community agencies and organizations, and at several outreach events held across the state throughout the last couple years. Our brochure is available on the Department of Human Services website, and in print by request using the Long-Term Services and Supports brochure order form on the same webpage. And I can post the direct link to that website in our comment section. So that's our brochure.
Thank you, Tracy, for sharing that.
Thank you.
Moving right along, we've got from Washington State, Dana Allard-Webb will be introducing Tracy Kalla with Lifespan Respite Washington.
And Dana, are you on? And do you want to do that, or she just said go ahead?
Oh, okay.
I'm gonna drive in. So it's fun to follow with Tracy. Always good to do that. Welcome and thank you all so much. So much gratitude to everybody for everybody's great work. Arch and our partners at ALTSA here in Washington State. We are very grateful. So we can go into our first slide. We had our stay home and stay healthy order as of March 23rd, which is also the same day that our primary full-time staff person, who had given us great notice and we wished her all success, that was her last day. So the team here all dove in. We are rapidly adapting and we're in continuous change. So one of the things that we brought forward was to share with our respite providers our survey results from those that are utilizing respite. And we sent them a report, and in that report we also shared that, which is not on the slide, but that our folks that are receiving respite did 4.5 stars out of 5 for the support they're receiving. They did 5 stars for the importance of respite. And we also were able to share with them some comments that were made from our care recipients. So this is a part of that report that we sent to our respite providers. Here in Washington State, we hit a historical high with 52 registered providers. Just as a point of reference, around April of last year, we had 19. And so just another point of reference, we, the team here at PAVE, were able to receive and start this work in 2018. So we're still new in us doing it, and we're loving it and so grateful for it. So as you'll see on the slide, you can see that we're currently at 218 just for this year. There's about of people in service and awards being granted. And also on this slide, we are sharing with you that we have a new searchable website feature for our care recipients. So we can move to the next slide. And what we're sharing you here and sharing is that we leaned into technology, particularly at this time and during this rapid transformation and adjustment that we're all doing and the disruption that we're experiencing, so that we can be there. And you all know and live this work, and we're so grateful to be learning with you and sharing and hearing your wisdom. It's definitely uplifting for all of us. So one of the things that we were able to do with our partners is to now put forward a searchable area for the 52 respite providers. And so when people come to that page, it's the current registered provider on our website. All 52 providers will be listed, and they are alphabetically. And all those little plus signs that you see, then folks can click any of those and reduce the search by county, by type of service, all of those good things that are really critical to our caregivers so that they can sort what they need. And the really nice thing about this whole adaptation in our technology is that the minute a respite provider comes forward and they are approved and they've given us the paperwork that we're required to have on insurance and all the other policies and procedures, they are automatically revealed. So they're up there instantaneously. If they change anything and add more services, it's instantaneous on our end. So it's currently there all the time. And we have about 6 respite providers in the queue right now. They're just waiting to see how their staff are coming through during COVID. And as, like all of you, our states are in many reopening phases. So we're happen to be in 2 and some are in 3, but nobody's in 4 in our state. And some have actually had to step back from 2 to 1. So the other nice part about this is that our care recipients can then, the page on the right, can download and print those, all their results. And so then they can make their calls, and we have the good questions that were provided by Arch on our website, so they don't have to start from scratch. And then our final slide, it came forward to us during our most recent coalition meeting. So we had been traditionally doing it, you know, like kind of every 6 months before COVID. We've now had one in March and one in May, and we'll have another one in July. So we are definitely leaning in and having people come forward through technology and all the ways that we're doing here today in order to stay in touch, stay connected, to support one another. And then one of our fabulous folks shared this artwork, and it was just a simple way that she was going out in her yard and collecting things and making these beautiful original pieces of artwork. And she was doing that, bringing it forward for all of us to say, this is something we can all do. It could be rocks, it could be stones, it could be branches, it could be abstract. But then the really nice part is she was then, you know, making a card and taking pictures of it. And so it was just a really uplifting thing for all of us to hear and see each other's creative ideas. And this is something that someone brought forward in our coalition meeting. So we wanted to share and end on that note.
Thank you so much, Tracy.
You're welcome. Thank you.
Wonderful information. We're now moving into our next topical area, which is volunteer respite. And we have actually just a wonderful video that we're going to show from the Rhode Island Office of Healthy Aging in conjunction with the Caregiver Alliance in Rhode Island on their Care Breaks program, which utilizes student nurses as volunteer respite providers. So Cassandra, you can just go ahead. Unless Aletha would like to say anything. I think she said to just go ahead. And do you want to say something, Aletha?
I just want to say good afternoon and thank you very much. The video certainly speaks for itself. Thank you.
Thank you for sharing it. Cassandra, we're not having any sound. Sorry.
Okay, I'm going to fix it. It should have kept playing the sound.
Did it have the mute at the bottom of the YouTube video?
No, it says it's, oh, maybe that's it. Oh yeah, there you go. I'm sorry, I'm gonna start again.
No problem.
I was so prepared. Sorry. Can you hear?
We don't see or hear at this point. You'll have to go back to share screen, I think. You're muted.
It says it's sharing sound. I don't know quite what happened.
I don't think you're sharing your screen.
Programs then, 5 years later, we now have 4 nursing programs, so we've added Salve Regina University. So the ultimate goal of care breaks, or generally respite overall, is to really make sure that we are focusing on the people providing care. To really give those intermittent breaks, whether it be once a week, once every other week, that opportunity to step away from that role to de-stress. And that's ultimately what we want to achieve at the end of the day, because we don't want to produce a whole new population of people who themselves have chronic illnesses later in life as they were trying to care for their loved ones. We have recently expanded in the last 4 or 5 years to also be partnering with 4 of the state's 6 nursing education programs. It started out first with Rhode Island College and the University of Rhode Island. We had 2 of the nursing programs then. 5 years later, we now have 4 nursing programs, so we've added Salve Regina University and New England Institute of Technology. And so when we started this, we had anywhere from 10 to 15 students per semester participating, and now we have over 40 each semester.
I decided to participate in the Care Breaks program because I volunteered last semester as a part of my pediatric rotation. I loved it so much. I made it my project, like my senior leadership project. I have learned that it's so important. It decreases caregiver burnout. It decreases potential child abuse because parents are getting burnt out. I've been surprised in how awesome parents are as well. It's like I call them super moms and super dads because it takes an amazing person to do it, and you don't really get to see that when you're just kind of working in clinical. I wish that I had known about it prior to my last year in college.
I'm passionate about Care Breaks and the Care Breaks program because it's something that I've been involved with since early in my nursing career. My students come away with a great awareness of what families deal with on a daily basis. When they're in home providing respite, they see the scheduling that families have to do with appointments and therapies, people coming in and out of the house, getting their child ready to go to school. For some of the kids, they're wheelchair bound, other kids are mobile, but they see the impact for the families of all that coordination of care when they're involved with the Care Breaks program.
I am the mom of Michael, who is a 12-year-old boy who has mitochondrial disease, which has basically rendered him incapable of taking care of himself. He needs assistance with all aspects of living and care. If I know that a student is scheduled to work with Michael at a particular time, I may be able to schedule something with one of my other children, like a doctor's appointment. I may be able to attend an after-school event, take a break, go out, take a walk. When you are a full-time caregiver for a child like Michael, all of those things need to be kept in balance. Otherwise, when I am not 100%, I can't take care of Michael.
Group respite care can take different forms through the Care Breaks program. We also now offer group respite through our partner University of Rhode Island's nursing program, which does something similar. On a weekend afternoon, parents can bring their children into the group respite opportunity, and they have activities and other programming ready and available. And this is both an opportunity for the child to socialize, but again, it is a different way for parents to feel comfortable knowing that somebody's there in case there should be an emergency.
I work full-time. My husband works full-time. I've got a 7-year-old son in addition to my 4.5-year-old special needs daughter. And while we have care right now while I'm at work, we don't have anybody to help, outside of working hours. When we have a caregiver or a respite or, any type of, even if it's just an hour where I can get out of the house, whether it's to meet up with my friends that are also bringing their children here or to spend time with my son alone, it's been life-changing. People forget that they need that me time, and I didn't think that I needed it. I thought that I was doing fine until I did it one time, and I realized how incredible these people were that were caring for her. And once you get over that initial fear of just doing it, you realize how important it is.
I have a daughter who is 3.5. Medically complex, requires full care, so she basically takes up all of my life. So it's definitely easy, especially from being a single parent, knowing that they're qualified people, PT and nursing students. It's only for 4 hours, but it's a great amount of time to recharge, talk with the ladies. This break once a month is much needed.
My daughter Hannah is 6. Her diagnoses are HIE and CP, epilepsy and CVI. We don't have respite at home. It's scary to leave your child in the care of folks that maybe don't know your child, but it just took one time to feel comfortable, knowing that that my daughter was going to be in a room full of not just nurses, but physical therapy students. The kids are in such capable hands. And it made the risk of bringing her here all worth it. It is a beautiful program. Just 4 hours once a month has been life-changing.
Thank you, Rhode Island and Aletha, for sharing that wonderful video about that tremendous volunteer program. Next, we were supposed to hear from Amy Nazaire in Massachusetts, but she's been called into an emergency meeting, unfortunately. So we will move on to Lisa Schneider with the Respite Care Association of Wisconsin.
Hi, everybody. That's a bummer that Massachusetts wasn't there, because I'm still wiping the tears from my eyes from that video. As a mom with a daughter with special needs, that really hit me. So anyway, hi, everybody. I wanted to tell you all how much I just get so energized hearing everybody's stories and how open everybody is to sharing. And hopefully we in Wisconsin continue to follow suit as well. We had a couple of things we wanted to talk with you about. The first one is our an opportunity where we're sharing our respite care certification program. This is our core training program that people take to be listed on our respite care registry. We've gone through it with a fine-tooth comb and have had the state of Wisconsin approve our training, that it covers all the core components of curriculum to just become a respite care worker. It used to be one long training that would take about 3 to 4 hours to complete. People can take it at their own pace, and it's all online and it's free. We've since broken it out into modules, so it's a lot more easier to separate and to take individually. But what happened as a result of talking about this, South Carolina and our CAW got to talking, and we've decided to have them have access to our free online training, and they're going to use the parts of the training or the modules that are not state specific. So so they are just, we're going to use our platform, drop our training modules into another branch of our platform that are all set and ready to go. They can put their own logos on, they can put their own colors or whatever they want to do. And then we'll provide the template for them to create their own state-specific training slides. The training includes slides, information, videos, pre and post tests, surveys, and certificates. So you're able to measure the learning that people have gained as a result of the training, and the certificates come in handy as well. People upload them to our registry and they share them with whomever they're hired with. We're also looking at if we develop some more online courses together, that we're going to continue to do that sharing. And I did want to say that we are not charging them anything other than for the additional seats that they fill for their training, and that would be billed on a monthly basis. So it's probably going to be, they don't have any more than 100 people in the training module at one time. It'll just be $50 a month, and that is the only cost that we would pass through onto them with no markup on that. So, but we did want to also put out there that we are open to collaborating with any other state Lifespan Respite grantees. So if you guys want to talk, just give us a call. Rachel?
Hi, Wisconsin's next brag, we have a small program called the Mini Grant Program, and the moral of this brag is you never know what small collaborations can lead to. So our first mini grant event, our successful applicant, we hosted in rural counties in Wisconsin. And we brought a unique opportunity to connect with local providers regarding respite care, self-care, workforce development, employment opportunities, and direct care workers. The original event, which there wound up being a lot more of these events in different counties in Wisconsin, but I'm just talking about this one specific mini grant application that morphed into something huge. So there were 25 vendors, and I don't know if you're familiar with Wisconsin, but the Northwestern region is very rural, and they lack services, and they have the highest aging population in the state. So with those 25 vendors, we had primary caregivers and paid workers. They were able to access their community resources, and it was a really beautiful thing to see. Lots of happy tears of joy because they felt isolated, alone. They didn't know about, I would say, 80% of the resources that were available to them. So it was really energizing to see, especially family caregivers and attendants, they felt a sense of support and just relief to know there were many resources for them they didn't know about. And then it was really cool because attendees that were interested in careers in the caregiving profession had opportunities to speak with educators and potential employers. I also saw people in attendance introduce themselves, and a mom who was burnt out caring for a child living with special needs. There was another gal that came up to her and said, "I'm looking to provide respite." So it was just an amazing opportunity. Well, after that was done, our CAW and the rest of the planning committee from the, hold on, let me just, sorry, those were my dogs. Sorry about that. So our CAW and the rest of the planning committee realized we were able to do such great things with that event, and we created a subgroup connecting communities and caregivers. Like I said, these events were replicated in various counties in Wisconsin. And then what morphed from that was the Northwestern Aging and Disability Resource and Workforce Alliance. That group is a subgroup from the original mini grant, and the Northwestern Aging and Disability Resource and Workforce Alliance, I think the title speaks for itself, but we really want to branch off of what Lisa talked about, the respite care certification program, getting people trained, and then really putting a lot of our efforts into the workforce. And we all know that there's the caregiver crisis. So it's supposed to say 2021. I think I know I made a typo. So essentially what's happening is there's going to be a workforce summit in 2021. It's going to be huge. It's going to be amazing. And the group is then writing plans so other regions in the state can replicate the same thing. So we're really excited about that to address the workforce. Next slide. Thank you. This was something that we recently did. We do have, once people successfully complete our respite care certification program, they are then able to be listed on the Wisconsin Respite Care Registry that our CAW manages. It doesn't cost for providers to be listed on it. It doesn't cost for people in need of help to search for somebody. But we really like to support those that have gone through the training, provide respite, and are listed on our registry and are really making a difference in people's lives. So we had a meaningful activities program. We sent a survey out to everyone listed on our registry, and we gave them options of creative activities to do with care recipients. We did ask that they kept the care recipient in mind, so it was person-centered. And we have been getting lots of pictures and testimonials, and it's really brought a lot of smiles to their faces. And that is what I have currently. Thank you so much for the opportunity to speak.
How are you doing?
Thank you so much, Rachel and Lisa. I think Wisconsin is really at the forefront here of recruiting, training, and supporting respite workers. So thank you for sharing all that wonderful information. And that actually brings us to the close of our very wonderful Bring, Brag, and Borrow session. Wonderful videos, wonderful brochures, wonderful materials, things to look forward to that are coming. So again, thank you all for sharing that. We are scheduled now to have our self-care break. And as we do that, I'm hoping that you'll take a moment to ponder this last question, if you're so moved. The question is, name one specific new idea, activity, or resource that you learned about during these wonderful Bring, Brag, and Borrow sessions over the last 2 days that you think you will use when you go back to your, well, you're in your states, when you go back to work and start finishing up your Lifespan Respite Grant activities or thinking about activities in the future. So if you tell us that, that would be wonderful. Again, take your little break, get up, move around, and we'll come back together at 3 o'clock for our Ask the Expert session, which will give you a chance to ask questions of each other, and then we'll wrap up. So again, thank you, everybody. We'll see you in 15 minutes. Welcome back, everyone. Thanks to those of you who responded to that last question. It's very helpful to see that there's so many wonderful things that you learned about the last 2 days that you'll actually be able to use in your everyday work. So we're really, again, very grateful for all of you being willing to share the great work that you're doing so that we can replicate it across the country. Now I'd like to open it up for questions and discussions. This is your chance. I hope you've been keeping track of who you wanted to ask questions of or who you wanted more information from. I also invite those of you who have your cameras off, if you'd like to turn them on, we'd love to see you as we have this discussion. Since we can't meet in person this year, it's so fortunate that we have the ability to see each other. Oh, welcome. Hello, everybody. You all look great, so don't worry. You look fantastic.
Multitasking here with everything. You have so much going on. Hi, everybody. I'm Shay from Arkansas.
Hey, anybody else want to give a shout out? Hi, that'll be great.
Hi, Shay. This is Tracy in Washington. It's all of you.
Hey, hey.
Anybody have any questions or comments? This is a great time for us really to engage with each other.
I know that my team in Washington has been sparking behind the scenes. We've been texting each other. We've been emailing and going, did you see that? Look at that. And so we've been kind of staying in one string to kind of compile some wonderful ideas. And it's just, I think, just that heartfelt gratitude of the re-energizingness of this with these, you know, conditions that we're all facing, and are most of all those that we're serving are facing. And I just am really grateful. So I think from our lens, we have a whole bunch of ideas that we're sparking up on, and I'm so grateful.
Thank you. I know your presentation sparked a lot of ideas for us too.
Jill, this is Shay again from Arkansas, and there was someone that presented early on, and they mentioned a guide for business. So being one of the partners for our Respite Coalition here in Arkansas, and we're trying to grow that, trying to really get the word out of how Respite has, you know, expanded beyond seniors. You know, it's for the parents with children and that type of thing. Me being a parent of a child that's autistic and has intellectual disabilities, I know how important it is. But someone presented, and I apologize, it was I didn't write it down, but they had a guide for business.
And that was, we had two states, Megan Kluth from Colorado and Dina Press from New York. Megan actually showed her guide. So Megan, do you want to talk a little bit more about that?
Sure. So I'm happy if you've got like a specific question too to take that. But I think to kind of get to your point of, we really wanted to take the approach, I think similarly to everything we do with Lifespan, of saying, you know, I think historically there have been a lot of conversations with kind of creating more child-friendly workplaces and family-friendly, and like really, I think there's been a lot of great work done by other groups in Colorado in the past 2 years to acknowledge that like every family looks different, and you know, it may be that you're worried about your pet, or you're in the sandwich generation, or whatever that looks like. So I think that was an important thing for us to say, like, we kind of need to look at this from, people have all sorts of different types of needs and they look a little bit individualized. So that's kind of why we took that approach. But are there like specific questions you have or things you're hoping to learn?
Well, specifically just, you know, I don't think we really have a guide. And although Sarah is wonderful, and she, Miss Susie had retired, and Sarah's one of the newer ones on the block and is doing a tremendous job with the resources that we have, you know. So just like you said, just kind of something that is shaped where we'll be able to say, this is what's available. One of my ideas, and I believe someone mentioned it, it's really honing in on the faith-based. I believe, you know, there's although we're doing virtual now, but the churches, beauty and barber shops, you know, I've got a couple of different ideas. You wouldn't believe, you know, just handing out things and handing out information to people to let them know what is available. Even in the midst of COVID, y'all, Arkansas received millions for essential workers. And I am the executive director for the Silk. So shout out to New York, because you've got a great Silk director that is my guy, Brad Williams. He's awesome. He's helped me quite a bit in the independent living community. But parents don't know about the funds that is available for essential workers, regardless of your income. And I felt so good to find out today that we actually, you know, presented that resource to a parent of 4 children, 2 of them with special needs, for daycare that'll be able to provide her. And she was having to take her children all, you know, 2 or 3 different places. The resources under COVID, even with the respite, it's not getting out there. And I don't know if you guys are, not to just start another conversation, but even with respite, we had, you know, a situation trying to just beg people to apply for the funds. So I don't know. What do you do? You know, so the guide for business is just one idea, you know, just trying to make sure we can engage people and get them interested and sparked to know this is available for you. And it's not just for Aunt Susie, who's 80 years old, you know?
Yeah, I mean, I think in terms of our guide, like there's very little in it that's Colorado specific.
Mm-hmm.
A lot of it I think would apply anywhere. So please feel free to, like, we are very open to people using it and sharing it and making it, you know, making it specific to your area. But you actually kind of, I think, led me into my question, which I think might be similar to your question, is I'm curious if people have found good ways. I mean, we've heard a lot about, there are some really amazing resources for, I think, prior to the pandemic and during the pandemic, but I've been thinking a lot about, you know, how many families just weren't connected to an agency before this, whether it's your coalition or others. And I think it's really great if they are connected and hopefully they know what you're offering. But I know in Colorado, there's, I mean, thousands of people that I'm sure don't even know where to start. And so I'm just curious if people have found ways, given the increased demand and given the, I think, you know, growing conversations around needs for caregiver supports, to kind of reach populations that maybe they hadn't heard from before.
Anybody want to respond to that? It's an excellent question. And I also think a reason that the employer type guides are so critical, because we're talking mostly about family caregivers who are not currently connected to a public service system at all. The unreached caregivers who are in the workforce and may not have any other way of getting or accessing this information. The medical community, another wonderful arena that we have to focus more on outreaching to, again, to reach probably the 50 to 75% of caregivers who are not known within the public service system. You know, how do we reach them?
Yeah, Jill, this is Kathy in South Carolina, and I think both, I mean, I'm real interested from Megan and New York as well, to really find out some of the strategies that they've used to get employers interested in using the toolkits, and how they've been able to really engage in that conversation with them. I know with us in South Carolina, we're working through a variety of strategies in the medical community. I think once the materials that Rachel was talking about in the presentation, like those, the cards that we're giving out, we've got one for pediatric offices, we'll have one for midlife, and we'll have one for aging. And so we'll be working through a variety of programs in South Carolina to do the outreach to those different age groups in order to get them to utilize those materials. And the video that Rachel was talking about, we hope to not only use it as an educational tool for providers, but it's going to be made in such a way that it could be played in the pediatric offices, so that as people are sitting in the waiting room, they'll be able to see and learn about respite and understand, you know, what it is and why they need it, and then how to access it. So we're hoping it'll have a broad-based tool, but it really is figuring out how to engage those communities to use those materials and help them understand. But so that's kind of back to my question with regard to the employers, because we've had more of a challenge engaging them necessarily than the medical community, and just would be really interested, because I thought the guide was great, but how Megan's, what have your strategies been that have gotten an uptick in the employer community to engage in the conversation and use your toolkit?
Yeah, I'm really curious what New York's experience with that has been as well. I mean, honestly, we were really kind of hoping to be doing a lot of that now, and it clearly hasn't happened, or we've kind of shifted focus. So, I mean, I think kind of though, because I feel like spent a few years having the same issue where it's like, how do you get in the door? Who's the right person? And I think, you know, I think you want to start small, but it's also kind of intimidating to think, well, if I can start with one business, then how many more are there? And so what we were planning to do is, so we connected with a group that's, I think they actually just went national with this, but it's based out of the University of Colorado School of Public Health, called Health Links, and they do like health and safety assessments for employers. And they actually, they either have or are about to add some questions about caregiving. That's kind of become another area where they've become a little bit more focused and just looking at like how we define family more broadly. And so our hope was to work with some of the groups that they've kind of identified that might be good, like test runs for us. So I think if you have anything like that, or if you have any like state level or local level, like, you know, certifications around health and safety in workplaces, or like the HR group that we worked with, it's like a membership group for human resources. And so I think anywhere you can get multiple employers in one spot, I think not only is that more efficient, but I think also just in kind of talking to different people, it made me think, oh, we are kind of approaching this from people that have more traditional, like 40-hour-a-week office jobs. And maybe that's not the industry we want to look at, or how do we adapt this more broadly? But I also think, like, you know, as things I think hopefully start settling a little bit more, I think there's a really good opportunity to kind of start the conversation, because I mean, one of the biggest recommendations to make things more flexible is allowing people to work from home. And I think every industry is now realizing that what they thought couldn't be done at home maybe could be. And so I think that's like, feels like kind of a low-hanging fruit for people to be taking on right now, and kind of trying that out or seeing how it's working. And I think people also are a lot more sensitive to, like, people have had their kids home and are trying to balance work while juggling remote school and all of that. So I think they're like issues that people are more can relate to. So it feels like pretty good timing. But I think in terms of, like, you know, we honestly haven't had a super successful strategy or something that's worked really well. But I think maybe start in one industry, or say I'm going to focus on small business, because, you know, what works for somebody with 10 employees is maybe not going to work for 500 employees. So that was just a valuable lesson for us of, like, there really is no one size fits all.
This is Cheryl in Nevada. One of the things that we're really going to be struggling with, and I'm sure many other states are going to be, is legislatively protecting funding for what in our state is considered non-essential service, which is where respite lands. And of course, we know that they've left caregivers basically holding the bag during COVID-19, when so many of our existing providers were impacted for various reasons. So I'm going to use some of these ideas on the awareness part. We've got a summit, now it's virtual, and a caregiver recognition event in Nevada in November that we're going to now need to kind of gear towards some legislative push before we go into a very difficult budget year, because a lot of our funding, as much as we can draw down from the federal government, still has to be matched with state funds and not be pushed aside by other priorities. So I think, so that's where our emphasis, anything that we can use to increase awareness, to build demand, to get those caregiver stories shared and be borrowed by all of our individual providers and our coalition, our agencies, so that we can really make a stand for supporting our caregivers in our next legislative session, is where I'm seeing all of these great messages, tools, and resources kind of getting pushed. We're looking, of course, at the workforce recruitment and efforts as well, so that we can supply them. But I think we're going to have to split. We're going to have to split with what is it when we don't have money, when we don't have resources, what are the alternatives, those creative ideas that Jill and others have talked about, what we're going to be offering if there isn't money to support the programming.
Cheryl, one of the things that we do in South Carolina every year is we have a Respite Awareness Day, which is at our State House. And as a part of that, we create something called Faces for Respite. And that's our Faces of Respite. And that's where we have stories of people who have used our respite dollars and to say in their own words, you know, what their situation is and what the respite meant to them. And it's a good way to, you know, literally put faces to the needs. And we do that across the lifespan, and those packets get disseminated to every legislator, every legislator. So that might be something you consider at your summit.
Yeah, and in fact, South Carolina has been so successful in getting big bucks in their state budgets for respite.
Yeah, and hopefully they will stay, but we may be facing the same thing Cheryl's talking about right now with the shortfalls.
Right.
Hi, it's Doris. Can you hear me?
Yes.
Yeah.
Awesome. Okay, so this is Doris from New York, and I just want to tell you about the University of Wisconsin workplace survey that we're partnering with them. And I know, Jill, it's probably accessible on the Arch website, or at least information. But what they do is they started it as a research project, and now they're just carrying it on, and they'll work with anybody. And what they do is they provide you an online link. So whoever you're working with in the workplace. So we've done it a couple of times. They send a link, and then the link just connects to a survey that they can disseminate to all their employers. I got stopped dead in my tracks from COVID, of course, but I started by just asking my HR person who the statewide or who the human resources group was, the professional group that they meet. And that linked me to several people who were local, who were happy to meet with me personally. And I felt like that was a really good way to connect. But what was fascinating is that every one of those HR professionals that I met with had their own caregiving story. And so they were all very interested in, and it seems to be a topic of interest around here to find out how to support caregivers in the workforce. So they sent out a piece that we put together, a marketing piece to their entire membership, so to like 500 businesses. So, I mean, that's a really good way to start, and I have lots of leads, but I have to wait for COVID to settle down before I do that. And what's really interesting and what I've been thinking about is it would be so cool, and Wisconsin is happy to modify the survey to make it personalized to whatever the workplace wants to know, is to find out how caregiving changed for folks in the workplace during COVID. You know, when you talk about the schooling and the kids and everything that has to be juggled. So, but I would tell you to reach out to Wisconsin, because my in with those businesses is to say, here's a free tool for you to use. And they provide this awesome report at the end. And then Wisconsin is just aggregating all the data for us for New York, just so that I can say, oh, across the state, this is what the experience is. And it's very cool. And I hope that it just takes off soon when things are a little less quiet in our lives. But thanks.
Doris, if I can just share to kind of piggyback on what you're sharing. Can you hear me okay?
Yes.
Okay, perfect. So just in some of, I think, the questions that have come about with regards to our guide that we developed here in New York, it actually started from legislation that was passed. So we partnered with our Department of Labor, a state level agency, and we ended up also consulting with our health department. And then we folded in the Workers' Compensation Board, who are the administrators for our paid family leave program, because we thought that, you know, including that information was really important to do. Coincidentally, the timing couldn't have been better, just in the sense of what Doris just shared and the work that she was pursuing, you know, with using the survey. We, at the same time, you know, were working on this guide. As I mentioned, Minnesota we felt like a very comprehensive guide that existed, so we had reached out to them and asked if we could use theirs more as a template, because we knew there was going to be some very state-specific material that we wanted to include, but we just really liked the layout and the look. And to be honest, you know how that goes when you have so many different partners that are involved in a work group, that I will say, at the end, it looks nothing like Minnesota's, but it really got us I think our starting point of just kind of laying out, you know, all the content and figuring out, you know, how best to share and what to share in the guide without making it too big. So it's about 10 pages. I like that we're pointing, you know, businesses to the coalition as well, so that in that follow-up they can work with them on maybe specific training needs that they have. What the work group decided to do that was really not part of the legislation, we were just basically in the legislation told that we needed to develop this guide for the business to have, to help them understand, you know, what it's like to balance your caregiving responsibilities and hold a job. And what we felt was that it needed to go beyond that. It wasn't just about educating the business, but we also wanted the business to have a toolkit so that they would have the materials on hand to be able to disseminate to their you know, employees, the caregivers themselves, of the various resources that are available for them. So we plan to continue the work. So even though we have the guide in its final state, and really hoping, you know, in the coming months, I was really hoping we'd have it available for this symposium, but unfortunately, you know, that work had to really come to a halt with all of the unemployment that Department of Labor had to deal with right now. So, but, you know, we're planning to continue the work that we started in developing supplemental materials, and maybe even some marketing materials that we can, you know, continue to build this into a more, you know, comprehensive toolkit and not just a guide for the business. Abby Lavazzo, who's on the call too, if she wants to chime in at all, she's really been taking the lead in just kind of compiling the content, working with the partners, setting up all the work group meetings. But I will tell you, what was really surprising to me was how much we learned from one another, because I don't think that the Department of Labor truly understood the statistics when we started to share. I think it was really eye-opening for them. They also didn't know the type of resources that are available. And I'm not sure about other states, but the Department of Labor had, and I can't think of their title right now, but they had a gentleman that they pulled in who was not able to be in person because they were a few hours away when we met for one of our work group meetings. He called in by phone, and his job is working with the businesses as like a liaison. So he goes out and actually educates businesses that are in need of like resources. So it was really great to have him be part of the conversation, because I think that's going to go a lot further, like you were mentioning, and getting your foot in the door with the businesses. The other thing was included in the legislation was a requirement that all of the state agency partners that are involved with this project are required to have this available electronically on each of their websites, and they also have to make it available in hard copy if, you know, if any business contacts them, and they have to let them know of the resource if it's a brand new business that is just becoming licensed.
So many great ideas. I just posted the webinar that Arch did last summer, where Doris referenced the University of Wisconsin Extension Service that has this employer survey that they will let you use for free, and they will help you analyze the data. I think, you know, we've demonstrated before, Massachusetts did this many years ago. They demonstrated that offering to survey an employer's employees to show them what the caregiving needs were among their employees was a great first step in the door. You know, not coming in and saying, we want you all to provide respite for all of your employed caregivers, but here's something we can give you to help you learn what your employees' needs are. So I encourage that. I also want to remind you about Nebraska's efforts around employer engagement. And they started very successfully with working with employees at the University of Nebraska. Sometimes universities are a little bit more open to providing those kinds of supports for their employees. So I can also refer you to some of the, actually Nebraska also presented on that same webinar with the University of Wisconsin. So you can learn more about what they've been doing with employer engagement in Nebraska. It's been very effective.
Jill, you're on mute.
I apologize. It's getting to be a long day for all of us. I was just asking if there were any more questions related to employer engagement or reaching out to the medical community, because those are two very important areas where we can really reach caregivers that we wouldn't reach otherwise. Especially around the CARE Act, where there's so much education, supposedly not as much as happening as we would like in states, but the discharge planners and hospitals who are working with caregivers going home, it's educating the discharge planners about respite and caregiver support would be another great group to target if you're targeting the medical profession anyway. I would include the discharge planners in that.
No, absolutely. That actually came up at our last state advisory committee meeting. And actually, I think our partner in the state office on aging has a contact with the hospital association. And so we're going to invite them to join those conversations specifically to really look at discharge planners.
I mean, some of the hospitals are so resistant to trying to compile this information. I would think they'd be really welcoming of anyone who's coming to them with information that they can share with people. They'd be very grateful to have it.
You know, the time is really right for that too with COVID-19, because if any of you have been reading about what it's like, what life is like after leaving an ICU, the respite would be a really key resource. It probably is not on the radar for discharge planning, but I think people would be open to the message right now.
Well, and I think particularly in those rural hospitals that are really struggling right now and trying to, I think, find ways to support folks in those areas. And even, with the emphasis on, readmissions and everything else, there's just a lot of ways that you can try to encourage the hospitals to engage in that.
This is Dina. We actually too, and I can share this, I'll get permission from them. I'm pretty sure they would be comfortable with it because they did share it with the rest of the state, but we had one of our local New York Connects program, our ADRC, who actually, they developed a packet for caregivers to work with their discharge planners. So they did end up sharing it we actually invited them to one of our monthly calls. So they shared it with this, with the other coordinators across the state. So I'm sure they wouldn't mind if I share it with Jill so that she can disseminate it. So I will make note of that and try to get that to everybody.
That would be wonderful. I think you mentioned that when it was first getting developed.
Yeah, I did. I think when we did the No Wrong Door call.
Yeah, we'd love to see that.
That would be great. Thank you.
Anyone else? Question for another one of your colleagues on any other topic?
This is Susan. A couple people commented about how much they appreciated Rhode Island's program to training nurses to be respite providers, and they're one of our candidates for innovative exemplary practice. So I've had the great pleasure of talking to them at that length. And one of the things the video didn't show, but was asked about in the chat box was about the training provided, to what the training is like. So yeah, good, Aletha, you're still on. Could you talk a little bit about that?
Well, the universities and colleges have set training curriculum for the volunteer students that they follow. And they actually have videos, but it's part of their regular curriculum. And I also wanted to say, you know, the video highlighted a lot of the families with children with disabilities, but many of the colleges that are involved with this program are also helping out caregivers who have older adults who need care and folks of other ages as well. But the group program at University of Rhode Island is mainly focusing on pediatrics.
I'm so glad you mentioned that. I was going to ask you, I know the program has expanded to so many other nursing schools in Rhode Island, and it was my understanding that other age groups were served too, so thank you for sharing that.
Yes, definitely across the lifespan. And we do have a Care Breaks program that provides a stipend. We have federal, of course, and we have a good amount of state funding that supports that program as well. But this volunteer nursing program is another option for folks in addition, so that they can acquire additional respite care. Right now during COVID, there have been check-in calls being made to the families. They haven't actually been visiting, but they've been keeping in touch with the families. And also the Catholic Social Services, which runs our Care Breaks program, they have reached out to families and offered other options, because our other respite opportunities with home care agencies has continued in full force. So we've been fortunate there.
And just to clarify, your other Care Breaks program that the Catholic Diocese runs, that's a voucher program, is it not?
It's not, no, it's not a voucher program. It's basically a stipend program. Each family is allowed so much. They're not actually given vouchers.
Right, right.
They can sign on, they can select from a list of home care agencies, and then the bill is sent to Catholic Social Services, and they cover that. So it's a little different from a voucher program.
This is Susan again too, and if I can brag about Rhode Island for you, Aletha. The procedures for training and for providing respite are so carefully outlined and prescribed, and you know, there's research to support what they're doing. They're well established, and I probably don't want to run on your program like you will become a TA agency yourself, Aletha. But if other programs could learn a lot from what Rhode Island has done, they've got their ducks in a row in terms of knowing what they're doing and sharing, being able to share information with others.
I want to say something. I'm very new to being assigned to this program. My predecessor before me and the nursing schools, like you said, have been tremendous, as well as our other partners. With that, they have developed a toolkit that we will be sharing. We're in the final stages right now. We're also working on a marketing and promotion plan to disseminate that video and the toolkit through social media. We're developing flyers that would give folks link. We've talked about reaching the physicians' offices, etc. But you know, also just trying to reach the more densely populated populations in Rhode Island, those non-English speaking, etc.
Well, that'll be something to look forward to.
Yes, so we'll be sharing. We'll be sharing, but we have some wonderful partners. It's been just a great joy, and I've enjoyed this conference very, very much. A lot of great ideas.
I'm glad you were able to join us.
Yeah, thank you so much.
Any other thoughts? Anybody jot down any burning questions you just couldn't wait to ask your colleagues as they were presenting?
Desktop folder.
Hello, is that somebody speaking? Well, I have a couple of questions for all of you then, just to get you thinking and talking, and because I also want to know, are any of you out there right now actively engaging the faith community? I know that South Carolina has done so much in the past, and you have your break rooms now too. Is there anyone else that is working in that arena? Again?
Jill? Hi, this is Aita from Oklahoma. And yes, our faith partners have been very instrumental in helping us with some of our community respite SIP shops programs. And we have found they're very receptive, and actually in their involvement have evolved into looking at other ways to provide really a ministry, I guess, for families that have an individual with a disability. I've seen it be, you know, across the lifespan, the focus. However, many of you know, SIB shops and a lot of our community respite programs have focused on children with special health care needs. But again, I think their participation in that has increased their awareness, and it's been really great to see our partnership with them. And I would encourage anyone who hasn't already looked into those partnerships, because again, they've been very receptive. And I did have another question that we don't have to go into right now because we're going to talk about faith-based partnerships.
No, that's okay. Go ahead.
It was on the, when Lance spoke earlier, he'd mentioned that they are working on calculating the value. I think, again, more than ever, as we're not only in a pandemic, but the economic impact, if there have been any of our partners either previously have looked at the calculating the value of caregiving in terms of, we always have a heightened concern about continuing to fund respite. And again, I think we all know in this particular conference, those of us who work with caregivers and know the importance of respite. However, when we're talking to legislators and they are looking at cutting, you know, reducing services, I just always want—
Do you mind sharing an elevator? Okay.
Always want to provide
What
them
floor?
with accurate—
Please don't forget to put yourself on
5 or 6, sorry. 5. Oh, thank God.
I always want to be in good position to provide them, well, this $100 saves $10,000.
I always forget.
You know, so that's a healthy concept perspective. So if anyone has had great success in providing it in a way that is impactful and actually gets them to see we're saving money by providing X dollars to respite. So I think Lance again had alluded that they are looking at calculating the value, and I was hopeful but couldn't get unmuted to have the conversation with them, but perhaps our partners across the nation have had success with looking at that. So someone who doesn't get it gets it with the economic savings to support caregivers.
Hi, it's Doris again. New York has had a lot of experience with building faith-based respite. The coalition actually started that movement by providing mini grants to different faith communities. If you were at the national conference last year, that's Erie County. They actually have 20 faith-based programs in their county, which was really supported and started by the Erie County Office for the Aging. So, but we know of faith-based respite programs in 11 counties. We have 62 in the state. So we continue to try to do that, and it's really well received. And the other one that we have one other one, which is it's college-based. So it's out of SUNY Geneseo, and they run a respite program with their social work and nursing students, and it goes 5 days a week during the school year. And it's really quite amazing. They've been doing that for probably, well, longer than I've been at the coalition, so 6-7 years. So it's a great resource as well.
I will just share too, this is Dina, that it's pretty innovative the way that Erie County did it, because what they did was they used a consultant who had a lot of experience with setting up these respites at, you know, faith-based organizations, and she was paid like per, I guess, organization that she successfully was able to set up. But really what she was charged to do was she would go in, provide them some all of the tools, all the resources, and understanding of what, you know, would be the expectations, paperwork that they should, you know, make sure that their volunteers are using, how they would go about scheduling. So they give them everything that they would need to get up and running. And then she would do like a touch basis call with them about a month out to see how things were progressing. And that was really the extent of her role and her work. I mean, of course, they could call if they were struggling or having problems, but so it was interesting the way that they kind of, the infrastructure that they built, and using this one consultant to kind of get things up and running across the county. So I just wanted to add that too, because it took me a little while to kind of figure out her role and how they successfully got so many of them operational and really sustainable, because they've been in existing for quite some time now.
However, she, that consultant she personally started the first respite in Erie County. And the cool thing is the county gets behind it by giving any church that that wants to start a program $1,000 up front to start buying supplies.
Thank you so much for reminding us about your wonderful mini grants, Doris.
Sure.
It's another great example we can look to if you're interested in expanding faith-based efforts. I just wanted to comment briefly on Aida's comment about cost benefit data for respite. It's something Arch has struggled with for 30 years to come up with good cost benefit data. And to be perfectly honest, there isn't any. I mean, if you're looking at the hardcore research around respite, it's very, very difficult to demonstrate that. In fact, the one study that I've seen, which had its own limitations, actually showed that respite was not cost effective because, in fact, and this was just a study of caregivers of frail elders, it actually wound up, because people felt good about leaving their loved ones somewhere else for respite, decided that maybe that was a good permanent placement. And so it actually led to a higher level of nursing home placement. But on the other hand, we have lots of other wonderful, not as strongly research-based data that is still compelling for policymakers. And we have that on our National Respite Coalition site, which is the policy division of Arch. So I'd be happy to share with you what we normally talk to policymakers about, but we wish that we had a lot better hardcore data. And I don't know if Ray wants to even address this issue, but there are things you can say. I'll put it that way.
And if Ray doesn't have something to say, I do, but
I'll
give Ray a chance.
No, go first. Cassandra, please go ahead, because they've done some wonderful cost analysis work. I can't believe I forgot about that. Please, Cassandra, share that.
Well, I got some of you may remember Hillary Arsky from England, who did some meta-analyses of respite programs, and she and I were hiking actually in Scotland when we got in an argument about whether or not respite worked, believe it or not, because she was talking about
that was the study I was referring to.
yeah.
Okay.
And she said, well, did respite actually prevent placements? And she found that no. And I said, well, that particular outcome, perhaps it didn't, pan out the way you expected it, but there are so many other outcomes that respite can provide. So if we look at the cost benefit of respite in perhaps increasing the health of caregivers, fewer caregivers going to their doctors for hypertension. So, you know, there are so many other outcomes to look at. And I think we have to be very thoughtful about what we're actually measuring. So that's what I have to share. And I still haven't finished the argument with her.
Well, that's what I'm saying. It's something Archie's been talking about for 30 years, and it's a very difficult issue that we have struggled with, but you're absolutely right.
I'll just add a couple of points to that, and that is that anytime you get into doing, well, cost analysis per se, but cost-benefit analysis in particular, it's really a hornet's nest because there's so many variables that people could include in the equation, and so many of those variables really that there aren't good cost data available to attach to those variables. So there's always a lot of speculation, there's a lot of model building, and so it's expensive research to do correctly, and that's why it hasn't been done, because it costs a lot of money to do good cost-benefit analysis. So generally what happens is people look for, and this is not just, in fact, it's very evident in other fields, the fallback is to go to the easiest source to access big data. So like you would look at Medicare data, for example, because everybody that's Medicare eligible, if you can get permission to get into the records, there's cost data in there. And then people try to extrapolate and back out of the source of where the cost data are and build their prevention model around that. So you can argue, deconstruct those studies in both directions, and it's kind of a slippery slope. It would be really nice to have even a small definitive study on something like reducing healthcare costs of caregivers of children with disabilities due to stress. Great, you could define that, but that study could take 3 or 4 or 5 years to run, and if you're going to do it, you need a sample size of 100, 120, and all of a sudden you've got a $250,000 study. There aren't a lot of sources to fund those kinds of things, so it's tough. We're still, as Jill said, we've been struggling with it for 30 years, and we haven't been able to figure out how to get somebody to pay for it, or how to get the data coming in a reliable way to frame those questions and studies.
Hi, this is Dana. Oh, go ahead.
No, please go ahead.
Hi, this is Dana Allard-Webb from Washington, and we've been doing family caregiver support programs for quite a while in Washington, way longer than the national, than most people have with the national program. And we did a short study, which we found it wasn't long enough to really give credible information. But what we have found, and what the area agencies on aging in our state tell me, is that after doing family caregiver support program since about 1989, that they have seen that yes, respite is important, and it really does help caregivers, especially caregivers who are in it for the long haul. And but it's also the programs that we have developed alongside respite that really help some people, sometimes more than respite in the long run, like caregiver education, like powerful tools for caregivers, counseling, support groups, durable medical equipment, anything that will pull the burden off of the caregiver. And that's kind of talking about non-traditional respite. But as we lose caregivers in our state, we still have frontier areas in our state where caregivers will not go, and islands where caregivers cannot go because they can't afford to. That we are really forced to try to figure out new ways of pulling burdens away from caregivers. So, that's not really a study, but that is what I hear from our 13 area agencies on aging who do this every day, provide respite for caregivers.
Thank you, Dana. I know Washington has a long-standing record of collecting great data on caregiving, and like you said, they've been doing it a lot longer than most states. I think we're getting close to the end of our time, and I really want to thank all of you for hanging in there. Susan, I don't want to put you on the spot, but were there any great emerging wrap-up ideas that maybe you pulled from note-taking or from the chat that we'd want to bring up at this point and leave people with memories of the last 2 days?
Well, I think I can say some of the things that stood out for me and also that I saw in the chat box were the power of videos to communicate. And I think since we were all crying after watching Rhode Island's video, that speaks for itself. And so I mentioned earlier that I thought it would be worthwhile doing some roundtable discussions. So, you know, we might want to follow up by doing a video messaging group. Some of those who have produced successful videos could gather with the rest of us who are interested in how you produced it, what kind of content, how you knew messaging would be effective, how you're disseminating it. So that was one of the things that stood out. So much interest in that employer toolkit and how to reach employers. So, and Jill has pulled some of that information together. My sister works for a national organization that I think the largest national HR organization, and she talks to states all the time. I've never talked to her about this, so I'm make a call to her and see if she can educate me. And if I find out anything, I'll pass that along. But that might be another kind of roundtable discussion that we want to talk about. Let's see, what else stood out in the chat.
One thing that really stood out in that last question that I asked during the break, a lot of people talked about wanting more information, especially around training, respite providers, and workforce issues. So that might make another great focus area where we can develop some new training and technical assistance tools. We've already got Wisconsin willing to share their training platform, which is amazing. And lots of you out there have also developed some training materials that maybe we could start from there and see what we already have on board that can be replicated or shared or improved upon. It's also just a tremendously critical area as we, especially in light of COVID now, making sure that we have the individuals out there who'll be able to provide respite and caregiver support is really, I think, one of the critical issues facing us in the next few years. It's no longer 10 or 20 years down the road, it's now. So I was so glad to see that so many of you mentioned that as an area that you'd be interested in getting more information about.
Yeah. The other thing that stood out for me in the discussion about cost-benefit data and the value of respite, and it took me back to, I'm of an age when I remember this discussion with early intervention programs, which now do have cost-benefit data, but at their beginning, people were saying, is it worth investing in the education of young children? And I remember a researcher and scholar, Nicholas Anastasio, saying at a keynote of the first conference for early intervention, that is the American question. Other countries, other nations, and we see this with the International Respite Association, take at face value that it's worthwhile to support people in our society who need support. The question we should be asking is, how do we do this better? So what I would say to you is go to the research agenda that Jill and Ray wrote, because there are all kinds of ideas of how to show the worth of your program in addition to just cost benefit. And I think we should all be doing that. That's a discussion we should have. And so many of you have used data to guide you during this COVID pandemic. And I think the better we get at showing what we do, describing what we do, allowing it to be replicated, being able to really articulate what we're doing with one another, we will recognize that value is not just cost savings. It's like knowing the price of everything and the value of nothing, if you've ever heard that expression. But we are accountable. We do need the data to show what it is that we're doing. And some of these videos actually do that really well, make visible the worth of what we're doing. So anyways, I'll climb off my soapbox, but it's not just cost benefit data that we need.
Thank you very much, Susan. I think that was a great wrap up from the last 2 days. I had just one quick request that I wanted to make of you, and I sent you all an email about this earlier in the week. The National Alliance for Caregiving is working with some other groups in the John A. Hartford Foundation to collect caregiver vignettes to be used in the final report of the RAISE Advisory Council. And they've asked Arch to identify 1, 2, or 3 caregivers from the non-aging population. Since we're Lifespan, we're more connected to those populations than some of the other groups that they're connected to, that can really speak especially to the importance of respite. So if you have any wonderful caregivers that you know of that might be willing to fill out a short survey, the National Alliance for Caregiving only wants a couple of names from us because I'm sure they're casting their net fairly widely. But if you can send me those names by Friday, and with the permission to send these caregivers a short survey, if you send me names, I'll try to piece through them and pick 2 or 3 that I can send to the National Alliance. So if you have time to do that, that would be wonderful. I've already heard from a few of you who've sent me incredible caregiver stories. I think Pam sent me one from Idaho, and Nancy sent me a great one from Delaware. So if you have any others, please send them my way. With that, does anyone have any other last final comments? Lori, do you have anything you'd like to share with the group? And thank you very much, Lori, for spending the whole 2 days with us. It was wonderful to have your involvement.
Thank you, everybody. I've learned so much. I'm taking notes and trying to keep all my brain cells together so I can process it afterward and have my own ideas, and look forward to working with everybody as we move forward. Thank you so much for letting me join you. Appreciate it.
And thank you for helping to arrange for Lance to speak with us earlier this afternoon. That was really quite an honor and very exciting.
When I asked you to hesitate, I can assure you, he said, let me check my calendar. Yeah. We're good.
I think he's just so committed to this caregiving issues that he's willing to take time. Yeah. Anybody else have any last thoughts? Well, let's all think optimistically that we will be able to meet in person next June in Madison, Wisconsin. We're going to do this international conference.
Wisconsin, let's go.
Let's go to Madison. We're so disappointed that we weren't there this year, but now we're really excited about it next year. And those of you who want to still help serve on the National Conference Planning Committee, we welcome you. There's not a whole lot for us to do at this point because we're going to have a lot of the same speakers and the same keynotes. But we welcome your involvement to help volunteer at the conference or however you'd like to participate. We'd love to have you. So thank you all very much. It was great to see all of you. I miss all of you. I wish I could see your faces in person, but hopefully next year.
Wait to meet people in real. Thank you, Jill. Yeah.
Thank you all so much, and we'll see you soon. Take care, everybody.
Bye-bye.
Bye.
Bye.